and vaccination opportunity in gynecology practice. As you all know, counseling is a very integral part of our practice, and this is uh, what is called that, whatever you can explain to the other party by verbal talking, this is called verbal therapy. Counseling is a verbal therapy, is a very, very important aspect of it. And short of counseling, our medical therapy remains incomplete. You can see there the key reasons why the gynecologist visit is there by every woman. Pregnancy, you can see that nearly 96% people in our country now it is one of the major reasons why the general public consults the gynecologist. But there are very many other reasons also. Being a woman, you have to come to the gynecologist. You have no choice. And all these visits of patients visiting a gynecologist is an opportunity to offer HPV vaccination. Not only offer HPV vaccination, this time the Delhi chapter of NIGF also took a mission that on adult vaccination, we are going to work on it for the next 2 years. So we must take this particular opportunity of talking about vaccination to all people. It is said that next to clean drinking water, vaccinations have eradicated the disease in a nuclear missile fashion. Uh, uh, all the diseases which had been there, minimum 90% of the diseases where the vaccination can be given, it can be eliminated. Now, there is a big hesitancy on a doctor's end as well as on a patient end. You will be surprised that the vaccinations are there since 2008 in our country. Almost 16, 17 years have passed. 50% of the pediatricians have taken up HPV vaccination in a very big way. But if as a gynecologist are concerned, I will say that in spite of a great work which has been done in the last 2 years, earlier to that, it has not been more than 10%. So we found, this hesitancy from the doctor's end should definitely get decreased. The way forward to improve the HPV vaccination coverage and preventing HPV-related diseases in India is that we need to strengthen the health education on HPV and HPV vaccination. Finding appropriate ways to solve the problem of vaccine hesitancy among the doctors and other healthcare professionals. You can see here that awareness in public about HPV and its vaccination is very low in India. I participated in a program from the Cervarix in the public as well as in the colleges, and sometime on the roadside in the busy places. When the journalist inquired from them, do they know about HPV? Most of the time they were confusing it with HIV. So I think a national survey, a national thing has to go in a very, very big way as far as telling the public in a big way is concerned. I hear the slide which is in front of you. We have not done any survey among the gynecologists, but a national survey of pediatricians have been done, where they have found that nearly 46% of the pediatricians they use HPV vaccination routinely, while the rest are still not doing it. So now, as for the public is concerned, there's a huge gap exists in public awareness about the cause, about cervical cancer as such. 10 साल पहले तो जब भी सर्वाइकल कैंसर की बात करते थे तो वो नेक पे हाथ लगा देती थी कि डॉक्टर yes, we have a cervical problem, but they do not know that we are talking about cervix, which is supposed to be the neck of the uterus. They do not know HPV and HPV vaccination. There's an urgent need for addressing this knowledge gap among the young adolescents and young girls and boys. The reasons for vaccine hesitancy among consumer is that they're all vague. Some people say this vaccine is effective because they know that COVID has been effective. Other vaccination which they have been taking in their childhood, they also know about it. But the survey which has been done as far as the HPV vaccine is concerned, they find one third feel that it is effective, another third feels it is not effective, and one third is, they feel very safe when they say they do not know. The reasons for not getting HPV vaccination is insufficient funds and fear of complications. And then there are vague excuses why they have not taken HPV vaccination. Now, effect of counseling by the gynecologists, by the pediatricians on awareness of HPV vaccination and its acceptance among postpartum women, it goes a long, long way. There are good number of people who do not know. 40% know about the cervical cancer, or they've heard about it. 40, just about 2-3% have known about the HPV vaccination, and not more than 8% know that there is some relation between HPV infection and the cervical cancer. So I think, a lot of knowledge gap is there, which has to be filled, not only by doctors, but the nurses and other paramedical persons. Now, again, the recommendations by the doctor and the healthcare professional, with a high level of commitment and motivation, results in acceptance of HPV vaccination. Sometime you motivate, you have enough time, they will take the first dose the same time. But if the motivation is good enough, then they will see to it that they have taken 2 or 3 doses and they do not drop out. So it all depends upon what kind of motivation you have done. It is just requires 3 to 5 minutes of motivation to the person and to their parents before they take a vaccination. Now, again, we find that all gynecologists say that the first time when they see a woman is when she's already pregnant. So again, pregnancy is the time to again do a counseling, and there has been a study done in Africa where they had enrolled 150 people, and they have taken a questionnaire to know what is their knowledge about cervical cancer, HPV or HPV vaccination. And then subjects were categorized into 2, whether they are ready to get vaccinated or not get vaccinated. And they found that the people who had opted they will get vaccinated after this questionnaire, which they had done, and the counseling which had been done during pregnancy, majority of them took the vaccination. Goes without saying that the vaccination was given free to them. Another study has been, 2-3 studies have been done. There's been again a study by Kahan. Again, this is a part of the Africa where the physicians were most likely, the kind of a positive attitude if the doctors have, they can definitely impact the public to have HPV vaccination. And this goes a very, very long way. All these patients contribute their motivation given by the doctor, and they're very thankful for the same. McCarvey found that healthcare professionals who feel comfortable talking with parents about the sexual implications of the vaccines was second only to the personal beliefs. So I think, doctors, their own perception also go a long, long way. So the clinician recommendation is effective strategy in improving HPV vaccination acceptance and adherence. Postpartum HPV vaccination, you can convert it to the tune of 90 to 90% on clinician recommendation, which has been given during pregnancy. This has improved HPV vaccination acceptance in a very big way as far as our country is concerned. And this is the best way of catch-up HPV vaccination if they have missed it during the 9 to 15 years time. And this is just a slide. I just repeat it again for people to know that as far as women are concerned, Gardasil 4 is from 9 years to 45 years. 2 doses are for 9 to 14 years, and 3 doses are there from 15 years to 45 years. A majority of the countries where the HPV vaccination is given, the emphasis has been till 26 years, again because of the budgetary thing. But as far as India is concerned, like many other places, it has been extended to 45 years. But there are still many countries like Canada where the upper age is, there is no limit for the same. As for the boys are concerned, now the studies from the European countries and from Australia has shown that you cannot eradicate the HPV infection completely from any community unless you have taken care of the boys. And last time when I had presented, I said if 80% vaccinations have been given to girls, boys automatically get the cross immunity. So, but otherwise, the boys also need to be vaccinated, and that is like many European countries and in Australia, it is there. Vaccination is again up to 26 years. The Servavac, which has come, 9 to 14 years, there are two doses, 0 and 6 months. And 15 to 26 year, there are three doses, 0, 2, and 6 months. And here I just wish to tell you that Gardasil 9 is again a gender neutral vaccine. In our country, it is permitted only from 9 to 15 years, and that also three doses need to be given. As for the SAGE recommendations are concerned, we are very thankful to the research wing of WHO, which has recommended that one dose is good enough up to 20 years. And they have recommended to each government, it is depending upon their budgets, they can give one vaccination or two vaccination up to 20 years. This is yet to be recommended by our own ministry, and has to be cleared by Drug Control of India. Then only should be a policy with us to use a single dose of vaccination. My request to each and everybody who's listening me, that till the time that kind of notification comes to you from the Ministry of Health or from the Drug Control of India, please continue the regime which you have been practicing till now. This single dose regime of HPV vaccination till 20 years is an off-label recommendations. WHO recommendation does not mean that every government has to comply with their recommendations. Just 1 minute before I get on to another.